ഇന്നത്തെ കെയർ ആൻഡ് ക്യൂറിൽ നമ്മുടെ കൂടെ ജോയിൻ ചെയ്യുന്ന ഡോക്ടർ മാല രമേഷ് കുമാറാണ്, ഗൈനക്കോളജിസ്റ്റ് ആണ്. NMC സണ്ണി മെഡിക്കൽ സെന്റർ ഷാബയിലാണ് ഡോക്ടർ പ്രാക്ടീസ് ചെയ്യുന്നത്. അപ്പോൾ എന്താണ് ഈ ഒരു അസുഖമെന്നും അതിന്റെ ഡീറ്റെയിൽസ് കുറിച്ചൊക്കെ നമുക്ക് ഡോക്ടറോട് തന്നെ. ഗുഡ് ആഫ്റ്റർനൂൺ ഡോക്ടർ ആൻഡ് വെൽക്കം
Good
ടു ദ ഷോ.
afternoon. Namaskar.
Doctor, what is this cervical cancer basically and how common it is?
Cervical cervix is the part of the lowest part of the uterus.
Okay.
It is called as mouth of the uterus. In fact, so it is the fourth commonest cancer in the woman.
Okay.
After the breast, the first is the breast cancer, second is colorectal cancer, and the
Okay.
third is lung cancer, and the fourth one is the cervical cancer. So it is very very important, to screen for the cervical cancer in all women.
Okay. So what is, how can we define the cervical?
The cancer is nothing but it is the abnormal multiplication of the cells. What we say it is proliferation. The
Okay.
cells multiply at an abnormal rate. What is
Okay.
a normal cell? So that is called as cancer.
Okay. So which all body parts does?
The cervical cancer is the part of the cervix is part of the uterus. So that
Okay.
is cervical cancer. It
Okay.
can affect the cancer can affect any part of the body.
Oh, no, my question was like when cervical cancer later on stage, which all parts?
It depends on the stages. It can limit itself to in 0 and 1. It can limit to the cervix itself.
Okay.
And as the staging progresses, like 2, 3, and 4, it can affect all the organs of the body. It can metastasize to liver, lungs, and the brain and all.
Which age group have cancer or age?
It starts. It is precancerous lesions start very early. It's at the age of 20 years.
Okay.
So it's very important to screen from that age.
Okay.
That's why the cervical cancer screening is very important. It
Mhm.
starts at 20 years, but it takes a long time to manifest. By the time we find it out, it would have been advanced if we don't screen early.
Okay.
So by the time 45 years, it will be a high risk cancer, which is like the survival rate comes down.
Okay. You're talking about the screening of the cervix, but then if we don't have any kind of symptoms or if there is any other presentation, how often do we scan or screen this?
Screening is not meant for when you have you have a complaint, you go to the doctor and get screened. Screening is not that. Screening is something like which you do it as a part of regularly you are checking like your sugars, you
Okay.
check your diabetes, like
Mhm.
you have got diabetes. It's just like that. You have to start this screening procedure from the age of 21 years. It is recommended from the age of 21 years, every 3 years,
Okay.
up to 30 years. Then after 30 years, you combine another test, that is by this screening is by pap smear, what we call it as pap smear. It is
Okay.
it's the name of the scientist who discovered it, Papanicolaou stain. So it is called as pap smear. What we use at present is a liquid based smear,
Okay.
So that we start from 21 years, every 3 years up to 30. And then also, then we add one more test, like one HPV test, like human
Yeah.
papilloma virus
Okay.
genotyping, we say. So
Okay.
we add the test to, so that increases the detection rate.
Okay.
If there is abnormality in the pap smear, we add this test. So the combined test, it can be done up every 5 years also.
Okay. So what is this PAP? Where is this? What is?
Yeah, the specimen is collected from, again, it's from the cervix.
Okay.
It's a non-invasive. It does
Okay.
not take more than 2 or 5 minutes.
Okay.
It's just we use a brush and we scrape the cervix.
Okay. And that you are
Yes,
that
yes,
sample.
yes.
Okay. What are the causes? General causes.
Cervical cancer, the cause is the HPV infection. Infection itself is that is human papilloma virus infection. See, like any other disease, we have a virus or a bacteria. This is human papilloma virus. It is a sexually transmitted infection.
Okay. That is the main cause.
Yes.
Apart from that, what are the other causes?
There are risk factors. This is the basic cause,
Okay.
HPV infection.
Mhm.
The other causes increase the chances of this HPV infection, like an
Okay.
early sexual life or an
Okay.
early marriage and having multiple sex partners.
Okay.
And many children, they tend to increase. And then the people who are using contraception for more than 10 years
Oh,
and smoking, these are all the risk factors for cervical cancer.
so when you mean to say that this is sexually transmitted disease, can we explain it like that?
Yes, yes, it is.
It is. Okay. Apart from that, you have any kind of genetical reasons?
It is like some people have like immunocompromised, like their immune system is down. So
Mhm.
this usually what happens is this HPV infection when every person, like we are all exposed to it at one or
Yes.
the other stage.
Okay.
It depends on our immune system.
Mhm.
It will, if our immune system is good, it will be cleared. But suppose our immune system is not good, it
Mhm.
stays forever, like it persists.
Okay.
So that can cause all these problems.
Mhm.
So you have an HPV infection at the age of 20 years, suppose, then you can have this some kind of high risk, we call it
Mhm.
as HSIL,
Okay.
high risk squamous intraepithelial, that's technical word.
Okay.
Okay, some kind of high risk infection at the age of 30 and 45 years. If you don't screen at this stage, you tend to develop an advanced kind of cancer. 45 and
So when we explain about cancers or when we talk about cancer, we always say that our lifestyle, lifestyle factors do contribute to the occurrence of. Are there any kind of lifestyle factors that contribute like
I
cancer?
told you about smoking.
Okay,
Smoking increases the chances of cervical cancer.
okay.
It helps in this HPV, this viral that chemical.
And obesity does lead.
No, obesity is
Okay.
for cervical.
So what are the early symptoms?
Cervical cancer, they can present with varied symptoms,
Mm.
like they can present with just intermenstrual bleeding,
Okay,
any menstrual abnormalities like heavy bleeding. They come with, I have more bleeding, I'm bleeding for a longer period of time, I'm
okay,
passing clot. And then they can have intermenstrual bleeding in
okay,
between the period, and there is bleeding after intercourse.
okay,
Then that is called what we call it as postcoital bleeding. Then they
okay,
can have pain after intercourse. And then post-menopausal bleeding, that is the person who has attained menopause, they can have bleeding. So that could be cause for, I mean, that is a symptom of cervical cancer. And apart from these bleedings, the patient, they can have this abnormal discharge, white discharge, what they come up with. They can have foul smelling discharge and other white discharge, or any persistent pelvic pain, like they
okay.
complain of back pain and abdominal constant nagging pain. That could be a symptom of cervical.
And how can we prevent this before we get the treatments and other diagnosis part? Generally, how can we?
Cervical cancer prevention is basically like, it is by screening. Okay, why you have to screen yourself from the age of 21 years every 3 years. The
Mhm.
person who has started an early six. Otherwise, it is, if, they have to use this condoms,
Mm.
preventive. So that helps in, spread of this virus. That prevent.
Oh, so when we take an average, statistic, how far it is like, how common is?
Um, in fact, I must say, like in women, it is after breast cancer. I think the cervical cancer is the commonest one. The statistics vary from nation to nation. UAE, it is because it is, it is related to multiple sex partners also. It is the
Okay.
third commonest cause of cervical cancer.
Okay. Apart from that, can we say like any kind of racial factors or regional factors do contribute, geographical factors?
That is what I said. Where there are multiple sex partners,
That is the
that is
only, there is no other
no,
climatic
no, no, no,
contributions
no,
or
no, no,
something like
no.
that. And people with cervical cancer, can they conceive?
Yes, of course they can conceive. There is nothing. There is no
No
problem.
problems. But there any complications will happen to that pregnancy or it will be like any normal pregnancy.
It will be like pregnancy will not be affected to
Okay.
any extent because
Okay.
it takes a long time. Cervical cancer, it takes a long time. So
Okay.
that's why we can, screen early and detect early and treat early. It gives us a chance.
Mm-hmm.
If we start screening at the age of 20 years, then we can detect it early so that we can treat it.
Okay.
So that's why even if in the pregnancy, if it is detected, we will not intervene. We will
Okay.
deliver and then take care of the.
Now coming to the diagnosis part, uh, what are the detailed procedures to diagnose these methods?
Cervical cancer, basically, what we do is this pap smear. I said earlier,
Okay.
we used to do a conventional cytology, a smear one. But nowadays, what we do is this thin prep, we say. That is liquid based cytology, where we collect we take a smear from the cervix into a liquid based medium, and then because the cell pickup is better with this, and then we study the cells. There are, if there are abnormal cells in that, then we categorize it depending on the, that is atypical cells of unknown significance, like we have some certain criteria, and this low grade, high grade, and all that. Then based on that we advise the other test,
Oh,
like this. The second one is this HPV testing.
oh,
We do HPV testing. Usually HPV testing is done after the 30 years. It is recommended after 30 years. It is combined with the pap test, so the detection rate will improve.
oh,
So if HPV testing is like, there are so many kinds of this papilloma virus. There are more than 150 types. So the most commonest genotypes are 16 and 18, which cause the cervical cancer, which are responsible for cervical cancer. So we do this genotyping, this high risk genotyping, and then if it is positive, then we go to the next step. This pap smear is positive and this HPV is positive, then we take them for colposcopy. Colposcopy, it's nothing but like a camera, where you magnify the part of the cervix to look for any abnormality, and we take a biopsy from there, and then we that biopsy, the specimen, the tissue specimen is examined under the microscope, and then depending on that the treatment is given, the next for further treatment.
oh. Now, like any other cancer, there are stages of developing this cancer. How can we explain the stage? Like, what are the presentations in the first stage, or what is the effect on your body in the first stage?
The first stage usually, as I said, like it always starts with this bleeding, menstrual irregularities. So we must think like it's not like always cervical cancer. The earlier phases, like early stages, they just present with some bleeding or some kind of discharge only.
Okay.
So we do pap smear, and then as I told you that we go to the next stage. If it is
Yes.
negative, the pap smear is negative in the beginning itself, then we will not do any other test. We will go further. We will call them, you have to do the pap smear after 3 years. Suppose if it shows some abnormalities, then we go for the next HPV testing, and after HPV testing we do the other test.
Okay.
Like that. So it is the 0 and 1 is usually limited to the cervix only. So depending upon the part only, we have symptoms like this bleeding or discharge, everything. So once it progresses beyond cervix, the second stage and all, it progresses to the uterus. Okay, so there is a more chance of bleeding because endometrium is there.
Okay.
So they can have more bleeding and all that. And after that, it can spread to the vagina, the down. So then the patients can have, depending upon that part, they can have some symptoms again. There's some kind of swelling or itching and all that, discharge and all that. And when it spreads to the other parts of the body, naturally they will have, like they will, when it spreads to other, they will have more symptoms like weakness and weight loss and all that.
So we were talking about the stages of cervical cancers, and I think we stopped at stage 2. So what are the presentations and what are the complications in the advanced stages?
Advanced stages, as I told you, it depends on the organ which it is spread. More advanced, beyond, it is beyond 3 means it is spread to the adjacent structures next to the uterus, the ligaments, the lymph nodes, and all that. They can get involved. Patient can have some kind of pain apart from the regular symptoms like bleeding and all that. And they can have weakness, weight loss, and all kind of this. And in the most advanced stages, it can spread to, the tumor these lymph nodes can press upon the ureter, and it can cause kidney, changes in the kidneys also. There is, the kidneys become enlarged.
That is the. Are there any situations where this leads to death? And
Yes,
this advanced stage leads to death?
Yes, it leads to death. Yeah, the detection rate, as I told you, the success rate of any surgery or any treatment is better if it is detected early and treated early. The more advanced surgery, usually we take this cancer survival rate like 5-year survival rate, like this.
Okay.
The patients survive for 5 years, like it is the percentage.
Okay.
So if it is detected early, then the survival rate goes up to 90 to 95%.
Oh.
So, and the more the stage and the survival rate, the number of years they come down.
Oh.
So it is that is the importance of screening in the cervical cancer. You know, if we screen and pick up those precancerous lesions which can be treated early, patient can survive. You know, more than 5 years, 90% of the patient can survive.
Now coming to the treatment part of the cervical, what are the general treatments?
It is like, precancerous lesions, like, which are limited. They are just in microscopic. They are not even seen to the naked eye.
Okay.
They are just in the cervical, in the cancer cells, abnormal cells.
Mhm.
So that can be like, what we call it as leap.
Mm.
It is we excise that part of the cervix.
Oh.
Okay. It is loop surgical excision, we say. So we have some kind of ablation procedures also. These are excision is you are cutting the part of the cervix. Okay, you're taking out. So then one more thing is conization. That is cone shaped cervix. That is the cervix, parts where which can undergo this cancerous change. That though these are all removed.
Oh.
Okay. So this is conization, and there are some kind of procedures. Ablation, in the sense you are going to destroy them, like laser therapy, and then or you are going to freeze them so that they will no more be active. So there are some kind of treatments for the precancerous lesion.
Oh.
And apart from that, cancerous lesions which are like, which are seen to the naked eye, are dealt in a different manner depending upon the staging.
Okay.
Okay, so that can be, the removal of the uterus, like
Okay.
hysterectomy, what we call it as hysterectomy, and then the lymph node removal, and there is chemotherapy, there is radiotherapy,
Okay.
it depends.
Okay. Depending on which stage.
Staging, yeah. There is stages like 3A, 3B, 3C, there are so many other stages. So depending upon the staging, they give.
If once a person is completely survived of each cancer, fixing it.
Recurrence, that's what I said, like, it depends on the advanced, like, cancer.
Okay.
So they've removed the uterus, so now there is nothing you can screen about.
Oh.
Okay, so the chances of course, recurrence, there is nothing to recur. So they have removed that part of the uterus. Only you need to follow up
Okay.
the lymph nodes and other parts. That's all.
You were talking to me like this HPV will lead to other type of cancers as
Yes,
well.
yes. There are HPV, there are 150 types of cancers, and this 16 and 18 are the genotype which will cause this cervical cancer. Apart from this, there are so many others like, 6, 11, with the 16, 18, and then 31, 35, 33, then 45. There are so many types, which can lead to this cancer of the vulva, vagina. Then in the males, they can cause penile ulcers, anal cancers. And this people who practice oral sex, they can have this oral cavity cancer and this throat cancer, tongue cancer. They can have all this. So, and apart from this, they can this even the genital warts what we see are caused by this HPV infection.
Doctor, thank you so much. We are almost up for time. Thank you so much for your ഇതോടുകൂടി കെയർ ആൻഡ് ക്യൂർ സെഗ്മെന്റ് ഇവിടെ പൂർണ്ണമാവുകയാണ്.